this is Cecily Henderson with Breast Implant Illness Healing. Today we're going to be talking about toxicology, risks, and complications of breast implants. Most of the information in this lesson has been directly gathered from the FDA website. So, according to the FDA, breast implants, certain labeling recommendations to improve patient communication guidance for industry and Food and Drug Administration staff, issued September 29, 2020. Each pair of implants are required to have a black box warning label. Now, this picture is a warning label directly from the implant box. Breast implants are not considered lifetime devices. The longer people have them, the greater the chances are that they will develop complications, some of which will require more surgery. Breast implants have been associated with the development of a cancer of the immune system called breast implant-associated anaplastic large cell lymphoma. This cancer occurs more commonly in patients with textured breast implants than smooth implants, although rates are not well defined. Some patients have died from this cancer. Patients receiving breast implants have reported a variety of systemic symptoms such as joint pain, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others. Individual patient risk for developing these symptoms has not been well established. Some patients report complete resolution of symptoms when the implants are removed without replacement. So let's talk about what are in breast implants. Now, this is derived directly from the FDA document, Appendix C, Material Device Description Example. The potential toxicity of the chemicals and metals listed in the following tables have been evaluated with both toxicity testing and risk assessments to assess the exposure levels in comparison to the amounts determined to likely be safe. However, individual responses to chemicals may vary, and all reactions cannot be predicted. So we've got different types of silicone for the shell, for gel-filled, and shell and fill. They also listed are chemicals released by breast implants, which is the volatiles, chemicals that are released by breast implants as a gas, extractables, which are chemicals that are released by breast implants following soaking in water and or organic solvent liquid. A lot of these are organic and non-organic compounds, and solvents are also included in the list. You have heavy metals that are found in breast implants such as antimony, arsenic, barium, beryllium, cadmium, chromium, cobalt, copper, lead, magnesium, mercury, molybdenum, nickel, platinum, selenium, silver, tin, titanium, vanadium, and zinc. Many of these chemicals in breast implants are toxic polymers, heavy metals, and solvents. If you'd like to know more information, there is a link provided. Now let's discuss the toxicology data for breast implants. This can get a little complicated, so I'll try to go help as much as I can as we discuss this. According to the FDA, saline, silicone gel, and alternative breast implants guidance for industry and Food and Drug Administration staff, document issued September 29, 2020, toxicology testing is recommended to be done by the surgeon on each breast implant before surgery is performed. Now, here's what the FDA recommends. So, toxicology data A, general information. We recommend you, which is the surgeon, provide a toxicological assessment because breast implants contain not only the major polymeric materials, but are also low molecular weight components. Now, D4 is a very toxic chemical from the manufacturing or sterilization process that may leach out into the patient's body. In addition to the chemical composition information, the toxicological safety assessment should include information from the pharmacokinetic studies and toxicological study and testing. So what does this mean? What the FDA is telling you is that the chemicals on implants may leach into your body and cause problems. So they recommend the surgeon test your implants before surgery. Now, this type of testing, the FDA recommends that the surgeon perform both the rabbit, pyrogen, and LAL tests. This involves an assessment of the toxic effects of a single dose or multiple doses of a chemical by oral, dermal, so skin, or inhalation. You have to remember, rabbits are exposed to the test substance for a minimum of 4 hours and are then monitored for a period of 14 days. Animals that die during the study are autopsied, so they do use animals in this testing. This test looks at how breast implant chemicals may affect your whole body or many organs rather than just a specific area. So it looks at your whole system. So let's talk about what the risks of breast implants are. According to the FDA, the following are risks of breast implants. Number 1, cancer, benign breast disease, connective tissue disease diagnosis, signs and symptoms, including fibromyalgia, interference of device with mammographic detection or of tumors, rupture, neurological disease, inability to lactate, offspring issues, safety of milk for breastfeeding and second-generation effects, potential systemic health consequences of extracapsular and migrated gel rupture, potential health consequences of gel bleed, depression, anxiety, and suicide, rheumatic diseases such as rheumatoid arthritis, systemic lupus, erythrodermitis, discoid lupus, scleroderma, vasculitis, polymyositis, and dermatomyositis. Rheumatic syndromes such as Raynaud's phenomenon, Sjögren's syndrome, CREST syndrome, morphea, carpal tunnel syndrome, multiple sclerosis-like syndrome, multiple myelomas-like syndrome, chronic fatigue syndrome, and fibromyalgia. I personally experienced 9 out of the 12 risks associated with breast implants. Let's talk about complications of breast implants. According to the FDA, the following are complications of breast implants. 1, rupture, capsular contracture, including the Baker grade, infection, calcification, malposition, extrusion, skin erosion, necrosis, lymphadenopathy, delayed wound healing, breast, chest, auxiliary mass formation, hematoma, seroma, pain, wrinkling, asymmetry, scar formation, palpability and visibility of the device, iatrogenic injury, alterations in nipple or breast sensation, interference and or difficulties with lactation, as well as the frequency of attempted lactation without success, difficulties with pregnancy, patient's death, breast cancer diagnosis post-implantation, mammographic difficulties interfering caused by the device, new connective tissue diseases, diagnosis, signs, and symptoms. Now, I personally experienced 14 out of the 25 complications listed above. So my final thoughts: the information offered in this lesson can be found in the links provided and on the FDA website. The data is medically tested, and patients may experience none, a few, or many of the risks and complications associated with breast implants. If you plan on getting breast implants, it may be wise to ask your surgeon about toxicology testing on your implants and to explain the risks and complications associated with the type of implants you're getting. Please feel free to email me if you have any questions, biihealingnow@gmail.com.